Um, I'm your GP doctor for today. My name is Mohammed. I understand that you've been having some issues with breathing lately. I'll go through symptoms and I'll look at the result you've obtained from the spirometry test that we've advised you to do. To start, could you please tell me more about how you've been feeling lately? Any signs of wheezing, shortness of breath, coughing, chest tightness?
Yeah, I've been getting wheezing and tight in the chest when I exercise or when I'm around dust. And
Yeah,
sometimes I wake
yeah.
up at night coughing too.
The fact that your symptoms vary and worsen around triggers such as dust or when you exercise is something we commonly see in asthmatic patients. Before the telehealth appointment, we ask you to undergo a spirometry test, which check how much air you breathe and how fast. I think a result obtained shows that you've been having airflow limitation, or your airflow will improve after using a bronchodilator. That tells us that your airway is very active and the narrowing is reversible, confirming a diagnosis of asthma. Now, just let me show you with some model on how this is affecting your airway passage. Can you see it? That's the healthy passageway, and that's the asthmatic air passageway. And the as you can see in the healthy one, the air passageway is very clear, and it's not inflamed, and the air flows freely without any obstruction. The smooth muscles are very relaxed, which allow air to flow in and out comfortably without any obstruction. But when it comes to the unhealthy one, you can see how it's being remodeled. It changed shape. That means there are many things that made it that way. For example, the narrowness, change of shape, that's called airway remodeling. That means the passageway is being narrowed, and that's make it difficult to breathe.
Yeah.
The muscles constrict in response to various triggers such as dust or when you exercise, and this process is called bronchoconstriction. There's also excessive production of mucus. Kind of fluid is designed to protect the air passageway from any harmful particles, but in the asthmatic patient is being excessively produced, contributing to blocking the oxygen from flowing inside your body. Another issue is airway hyperresponsiveness. Uh, is when your airway overreact to harmless stimuli, leading to more tightening and more inflammation. And this inflammation affects your body to exchange gases efficiently. Normally, oxygen get inside your body and carbon dioxide is being kicked out of the body. This
Yeah.
exchange of gases in an asthmatic person is very inefficient because the airway passageway is very blocked because of the various reasons we've mentioned before. Now let's look at how these symptoms, reasons we've mentioned, play a role in the symptoms that you've been experiencing. For example, when it comes to wheezing, the airway is very narrow. It creates resisting and causes whistling sound. And for when it comes to shortness of breath, we have tight muscles, and you've got your airway inflamed, which reduces the airflow, making it hard to breathe deeply. For example, and when it comes to coughing, there's a reflex triggered by the body as the reaction of the excessive mucus production within the body from anything that's blocking it. And chest tightness, this is due to the constricted airways, and inflammation, causing pressure and discomfort in the chest. If you experience these symptoms before the bed, after waking up, or when exercising, you can take a bath ahead of the activity to prevent symptoms. Let's use a simple analogy to represent all of that. For example, we can imagine a house and the water is flowing inside it very clearly without any obstruction. And you can represent the opposite. You can represent the asthmatic airway as being the house squeezed, and it is clogged by the excessive mucus production within the body. So the water inside the clogged house cannot flow clearly. So that's a simple analogy to summarize all of what we've talked about. And the good news, asthma can be very well managed with the right treatment and with avoiding the triggers. Because your symptoms are occurring more than twice a month, we will start a combination of inhaler that works as both preventer and reliever. And we're prescribing Symbicort 200 flash 6 and for Spiromax 200 flash 6. These contain budesonide to reduce inflammation in your airways, and formoterol to open your airways quickly. Symptoms are present. You will use the inhaler as needed. Take one puff. If you feel symptoms like tiredness, wheezing, or coughing, place the mouthpiece between your teeth, seal your lips, and then breathe in hard as much as you can. Hold your breath for at least 5 to 10 seconds, and then rinse your mouth after each usage. Would you like to try while I walk you throughout this process?
No, thank you. That makes sense. Thank you.
Great. We will get script and action. Everything is sorted today. With the right inhaler technique and a plan, asthma is very manageable. I'll send the script and the plan through to your email, and that's it. Have a great day. Goodbye.
Thank you very much. Have a great day.